Trump administration is following through on a campaign promise to combat the opioid crisis as the death toll rises across the country from the highly addictive drugs. CDC statistics show more than 63,000 people died from overdoses in 2016, up more than 10,000 from the previous year. Of that, opioids accounted for 2/3 of the fatalities. Deaths from synthetic opioids more than doubling, and heroin overdoses rising as well. Let's bring in FDA Commissioner Scott Gottlieb. I wanted to ask you, sir, is the opioid crisis the most vexing and most urgent problem that you're dealing with?
I think it's our biggest public health challenge right now facing the agency. This really began as a problem with prescription drugs. I think it's migrating to a problem more and more that encompasses street drugs. We see people transitioning onto street drugs. But most of the new addictions still happening from people who are first exposed to opioids through a legitimate prescription, a lawful prescription. So from our vantage point, I think where we can play a very important role is trying to cut down the rate of new addiction by rationalizing prescribing. And we have a lot of tools to do that, and we've been focused on that part of the mission.
I know that President Trump said recently, and the Attorney General is talking about suing certain drug companies for problems, possibly ones in the past. But is that a productive way to do it if you're also trying to work with those companies to find pharmaceutical alternatives to either treat opioids or to find another way to treat pain?
Well, I'll leave the considerations about litigation to the Justice Department. I think that, we all made mistakes in the past in terms of my agency as well, in terms of our view about the addictive potential of these drugs. I think if you go back 15 years ago, we didn't recognize how addictive these products could be. So now I think the key is to try to recognize that we need to bring down the rates of prescribing. It's not just that too many prescriptions are being written, but when they are written, they're written for too many doses. And so we do need to work with the companies. We also need to work with companies to try to develop treatments for addiction, better medically assisted treatment to help the people who are currently addicted.
I know that Congress has allotted $500 million to fight the opioid crisis, but a lot of the states have not spent the money on that. And so I guess that maybe they're waiting to figure out a way to help fix the problem, because what do you spend the money on?
Well, a lot of that money is focused on treatment, and so they've allocated it. The states have to make decisions about how they're going to apportion that money on treatment. We recently got a slug of money. We got $94 million in the omnibus in the FY18 that we're going to focus on interdiction efforts. We play a role in the international mail facilities, trying to ferret out illicit drugs coming through those mail facilities. And a lot of the synthetic drugs that you talked about are coming through the mail.
And then what about, tell me what you're doing on nicotine, because I know that there's some controversy. Anytime people talk about nicotine, and especially e-cigarettes, and there's controversy regarding e-cigarettes, what are you trying to do?
We're trying to take steps to reduce the addictive value of cigarettes by rendering them minimally and non-addictive, by regulating the nicotine in combustible cigarettes. At the same time, we're looking at opportunities to try to transition currently addicted smokers onto products that could be reduced harm, could be modified risk products, including potentially e-cigarettes, which need to be put through an appropriate series of regulatory gates, but they might pose far less risk than smoking combustible cigarettes. We're also trying to open up the market for product innovation on nicotine replacement therapies like patches and gums, trying to bring more product variety for people, adults who still want access to nicotine, but we want to render the cigarettes themselves minimally or non-addictive.
And then my last question for you, because I wish I had more time with you, but I'm really interested in one of the things I believe that you said going into your job is that getting more drugs into generics sooner will help lower the price of prescription drugs for Americans. And you've made a lot of progress on that this past year. Is there more that can be done?
That's right. We approved a record number of generic drugs last year, more than 1,000. We think there's a lot more that we can be done. We see activities in the marketplace that are impeding the ability of generic companies to bring drugs onto the market, actually frustrating their abilities to do the studies they need to do to get their drugs onto the market. We've been trying to attack those, what we call shenanigans, sometimes played by the branded companies, where they make it hard for the generic companies to do the studies they need to do to copy their drugs.
And then so I wanted to ask you also this about, I think we only have 90 seconds, but the president had said that this issue about right to try, it's legislation that's important to a lot of members. The vice president talked about it a lot. The president talked about it in the State of the Union. And this would allow people to try to do treatments based on drugs that are not yet approved by the FDA. What is the role that the FDA has in trying to get right to try passed?
Well, we've been providing technical assistance to Congress. There's a couple of different bills working through Congress. One was passed in the Senate. There's another bill in the House. That House bill recently passed the House and now is going back to the Senate. We provided technical assistance to the committee that was drafting that bill, trying to build in certain patient protections, which they did. So we think that there's important patient protections built into that legislation. Now it's up to the Senate to see if they pass it.
If they can match that. Well, we appreciate you coming in today, and we will touch base with you. The opiate issue is something that Fox News certainly covers a lot. lot, and we're interested in how we can both prevent people from getting addicted and then treat them if they are.
Thanks a lot.
All right, Scott Gottlieb of the FDA, thank you so much.